Welcome to another episode of I Am Change podcast. My name is Rafiat Akiwande, and today's guest is a name that stands tall in Nigeria's healthcare advocacy space, Dr. Zainab Shinkafi-Bagudu, a pediatrician, cancer advocate, and global health leader. She's the founder of Medicaid Cancer Foundation and Medicaid Radio-Diagnostics and Clinics, the first of its kind in Abuja. Her work spans clinical practice, public health reform, and international policy. In this conversation, we explore her journey through medical education in Nigeria and the UK, her fight against cancer through one of the biggest annual works in the country, and the broader challenges facing Nigeria's healthcare, such as brain drain and maternal and infant mortality. It is such an honor to have you here, Dr. Zainab Shinkafi-Bagudu. You are a pediatrician, a cancer control advocate, and president of the Union for International Cancer Control. That is quite a packed CV. And today we're going to just be talking to you about an overview of you and the work that you've done in the health sector in Nigeria. So I want to start from the very first easy questions that will just ease us in. You trained as a doctor and then you went abroad to practice. What did working in the two vastly different systems actually teach you about what healthcare should look like?
Well, first of all, thank you for having me on your podcast, and well done for the work that you're doing to enlighten different age groups on various topics and trying to bring change to our country and general lifestyle. Mine is the health sector, as you have rightly identified. And indeed, I trained in Nigeria. In my basic training, of course, primary, secondary school. I'm a Nigerian fully. And then for the specialization, I was opportune to train in the United Kingdom, where I trained as a pediatrician. They're two vastly different health systems, of course, because they're two different economic backgrounds for the countries, as well as sociocultural differences. So those were I would say, the pillars along which my difference or the learning points that I picked up came about. If you're practicing in a high income country, you have access to a lot of facilities, you have access to treatment, diagnostic support, and so on. But the basic skill remains the same. And one of the things that I immediately picked up on when I started my training in the UK was that we had a lot, when I say we, I mean those of us from Africa and other low income countries, we have a lot of practical skills. We were not opportune to have the supportive environments such as diagnostic equipment that was necessary to aid and abet us. So that sharpened us. And without doing a barrage of tests, we're able to really arrive at a diagnosis without that support. So having that system in place made it much easier. But I would also say it made me a little bit wasteful. One of the things we were taught in Ahmadu Bello University, Zaria, where I trained, is your patient has 5 naira. At the time, you could do a test with 5 naira. Your patient has 5 naira. So you're looking at the cost effectiveness and what's one test are you going to run to ensure that you get the right thing, right diagnosis for your patients and the treatment, of course. But over there's even some, should I say, caution. If you don't do a lot and you don't cover yourself, there's a lot of worry about litigation. So you have to make sure you cover everything. And sometimes it's not as necessary as it's supposed to be. So I think that taught me how to be wasteful and then also how to be cost effective at the same time. I appreciated that difference. The sociocultural differences are a lot. And that was challenging, really, really challenging, even right from the medical system, from the professionals, the healthcare professionals, how you relate to other cadre, how you relate to the patients, and so on. Sometimes you face issues that border on, should I say, racism. Not that intense. I must say I was lucky, but it does come up, and you have to know how to deal with it without it affecting your work and without it causing a problem for the hospital that you're training in. So I think in a nutshell, those are the things.
It was really interesting to hear about how the situation in Nigeria sharpens diagnostic skills of doctors, because you know that people don't have a lot
Mm-hmm.
of money, so you have to think fast and you have to think really quickly and you have to think
Absolutely.
more accurately, as opposed to over there where you have the opportunity to run as many tests. That I did not expect. So thank you so much for that one. My next question actually is going to be about something that you have been very passionate about. You've done lots and lots of work in this particular area. And I was just very intrigued and I wanted to ask, what motivated you to start the Medicaid Cancer Foundation? What exactly did you see in Nigeria that convinced you that cancer advocacy just couldn't wait anymore?
Okay, so the Medicaid Cancer Foundation was started out of the realization that awareness was really poor, and women in the area I was practicing were not aware and didn't have enough education, knowledge, and support about things that had to do with their breast health. And that is how we started. It was focused primarily on breast cancer. As a pediatrician, I was seeing children who are primarily brought to the hospital by their mothers. And so when the mothers have an issue, they tend to bring it to me, and or they used to bring it to me at the time. And this is what spurred me to start supporting them, to set up a diagnostic center where we were offering mammograms, and we were able to teach women the basic things. And then as time went on, we responded to various needs. If they do a mammogram and they find a lump or they find something, what do they do? So we need to support them to access care, to do a biopsy, to do pathology testing, to see a doctor. Sometimes, unfortunately, it has to be to access chemotherapy and radiotherapy treatments and so on. And then when we tell them to do that, so we started venturing into fundraising, and we tell them to do that, and they come back and they say, oh, it's not available, it's not there. That's spurred the foundation to start high level advocacy, working with government, working with partners, working with industry, insurance providers to broaden the reach and to broaden the availability of solutions to cancer signs and symptoms. So that involves a lot of high level advocacy. And I really think that is the level at which I am now. Not so much the awareness. Of course, we're always doing awareness. The foundation is always involved in that. But where the key and the importance lies is how much more can we do for our people? How can we make it affordable for them? How can we provide the centers that are required for treatments, for diagnosis, for prevention? And this is where I do more of my work now.
It's very, very impressive. And it's so interesting because you're a pediatrician. So, most likely, these women actually trust you. So, most times, you're like their first source to say, doctor, what's wrong with me? This is what I have. And it was interesting how you linked that to coming up with such a beautiful foundation. You also do cancer walks every year. And we're in a country where people feel like a big, nothing is really working like that. And yet you continue to do these cancer walks every year. What is that thing that makes you feel like this is such an important thing to continue to do year in, year out?
The work started primarily as an awareness program where we would gather people in Abuja. We do the work in Abuja. We had a few in Kebbi, but mostly in Abuja. And it's to create awareness about cancer. Generally, we don't focus it on one. And then it's also to provide fundraising. Through the work, we sell paraphernalia, and we're able to raise some decent funds that we can use to support patients through the year. We have corporate sponsors, and because it's so loud and big, companies are interested and they want to support and do their CSR through that avenue. So it really has been successful. Every year there's something new. It's 11 years now, and every year we try to variate it a little bit so that it doesn't become boring. And it's become a means where people can exercise. I've heard different reasons for coming to the walk. Some people have cancer. Some people have relatives that are living with cancer. Some people have lost a loved one or friend to cancer. And some people just want to come and have their exercise. Some for them is daily, for others is that once a year that they will do that walk. So it's really very variable. And whatever your reason for walking, we welcome you and we have a lot of fun, create a lot of noise, and people stop and say, what are these people doing? It's not limited to the physical walk on the day. It goes on for at least 3 weeks before and after, where there's social media amplification about the walk. And alongside it, we make sure we drop educational nuggets for people to learn. How do they perform a self-breast examination? How can they access the HPV vaccination? What do men need to do when they start having urinary symptoms, and so on and so forth? So that is the ethos behind it. And the more we do it and people come out, then there's no reason to stop. We have to continue raising the bar and ensuring that we meet up to the needs of Nigerians, particularly the youth. They're very fond of it. We've infused some fun aspects like musical, semi-small concerts alongside with the walk. We invite celebrities, both from the movie industry and music industry, and they find it very engaging. And so they come out in large numbers. So it's one of our programs and one of the successful ones. So we thank God for it.
That is beautiful. And yes, the youth would definitely be interested in something that is, framed as a concert. But I love the different aspects that you've included in the work, such as educating people while the work is also happening about different aspects of cancer and how they can take care of themselves and the things that they can do. I want to move now to a very
Mm.
important topic. And this is a topic that is always making the rounds, and while some people feel, oh, it's not that much of a big deal, the statistics definitely show otherwise. And what I want to talk about is Nigeria's maternal and infant mortality rates. The statistics are staggering, which I'm sure you're aware, being a pediatrician. And behind every number is a
Mm.
name. I think most times when we look at the statistics, oh, 33% or 50%, we don't realize that those are actual people. Those are people's wives, people's mothers, people's aunties who have been lost in this thing that should not be like that. So I want to ask, what exactly
Mm.
is it that we're failing to as a nation when it comes to women's health?
Well, I wouldn't particularly say that we are failing. It's just that there are different factors involved. Again, it sounds boring, but at the bottom of a lot of our, I would say all our health issues, is knowledge and awareness. Why do women die when giving birth? Do they go to the hospital? How many of our pregnant women go for antenatal care? How many deliver in the hospital? In Kebbi, it was something, the highest we got it to was 30%. How many of our children are being immunized against the deadly childhood diseases that are killing them? Diphtheria, polio, all the measles. We still have such low coverage rates generally. And why is that? It's about culture, it's about knowledge, lack of awareness. A lot of women in the rural areas, they don't have the knowledge of how much these vaccines protect their children. And then there's also the issue of access to the primary healthcare centers. You'll be surprised at the number of Nigerians that are residing in hard to reach areas. They have to go on boats or a motorcycle to be able to reach their nearest primary healthcare centers. So we are doing a lot, but the next issue that I will identify is that Nigeria is large. We are a very, very enormous country. To cover the entire country, nooks and crannies, with the kind of facilities that is required is something that we have not yet mastered. We have not mastered it because of the costs that is involved, and it causes, that is what is behind a lot of our issues. We do not have adequate health insurance, but that is picking up. All these things we're talking about are picking up. There is health insurance available now, especially for the formal sector. Informal sector as well is also being covered, but it all adds up and gives us the high infant mortality rates. If we're able to combat and conquer our misconceptions, misinformation, the wrong messages that have been spread through various communities, then we will be a lot better off. Malaria is killing a lot of people simply because they will not sleep in a insecticide-treated mosquito net, which are available, by the way, free of charge, provided by most state governments. So these are some of the issues. It's a complicated one, but I think that the governments, through the various cadre, primary, secondary, and tertiary healthcare systems, are doing something. I know we're very fond of saying, oh, there's no this, there's no that. Yes, there isn't, but is there an attempt? Is there a credible attempt to address those issues? Then I would say yes.
I think I love how you ended it, saying that is there a credible attempt to address those? And the answer is yes. I mean, we do come across most of those public service announcements. We come across the ads on TV saying, go for antenatal, go get your mosquito treated net, and all of those things. And I do hope that there comes a day where we can say this is no longer the order of the day in Nigeria. So yeah, I look forward to that. Now, because our podcast is very youth centered, and there's a very
Yes.
interesting wave of brain drain happening, especially in the health sector right now, where we have a lot of doctors leaving Nigeria to go seek greener pastures other places. And you've studied there, you've studied here, you've seen both healthcare systems. And I think my question is, how does it make you feel that all of these doctors are just on an exodus out of the country? And a follow-up question to that will be, is there really anything worth staying for when it comes to Nigeria as a doctor who wants to continue to work in healthcare?
Yeah, it's unfortunate. You're right. Brain drain has really affected the health sector and it continues to affect us. The effects, I would say the trigger was markedly raised during the COVID pandemic, where high income countries were actively recruiting from those of the countries of the world where they had high numbers, like Nigeria, and people were willing to go abroad. So it's not a pleasant situation for somebody in my position who is a leader, and I like to see the best solution for my country. And at the bottom of that solution, at those solutions, is the healthcare capacity and the number of human resource that we have. It's not just doctors; it's all healthcare along the entire spectrum, not the professionals. You have community health extension workers going abroad to be healthcare workers, to be caregivers. You have even doctors being caregivers, dentists, nurses, you name it, we're losing them in very high numbers. However, it's interesting that once they go, then they see the flip side. I talk to a lot of, like you said, this is a youth-centered podcast, and I do interact with medical students or newly qualified doctors. And when you say this, oh, it's not as fantastic as it is, they just go, okay, okay. It's very difficult to stop them. There is the financial pool. There is the pool of the greener pastures. It's not just the take home check, but it's also about the social welfare system, the availability of normal, social facilities for their families, schools, education, security, and so on. But right now, the doctors in the UK are about to strike because of their take home check. I was surprised. I saw a little clip yesterday evening. A consultant was earning something that I earned maybe in my second or third year as a trainee doctor. And this is what is happening now. So really, we just keep emphasizing the grass is not as green as it looks on the other side. But that is whimsical and that is just, a mother talking. There are practical things that need to be done. Aside from improving the pay of our own healthcare workers here, which again is an issue because there's so many priorities that the government has. How much are they going to keep increasing? How much are we earning and so on? But also to provide them with insurance in the sense that they have reasonable pensions, they have better schools for their children, improve the security and so on. Like you said in the beginning, I trained in the UK. And during COVID, in fact, way after COVID, up to recently, I kept getting emails from the GMC, that's the council that registers doctors in the UK, asking me to come back for no fees, nothing, just come back. They will send you an email if you don't want to click here. I will click here. I don't want to. But the next week, the email will still come. So there was an active effort. Now, that effort is fine and it's their right to do that. So, can they now put a contract spectrum to it and enter into contract with us where we have quotas? We're getting there. You can see that all across the world, it's becoming not just the US with the new administration, but even in the UK, the immigration laws for studying, for training is getting more and more difficult. But if we can put quotas so that that labor exchange is continuous, we can export and they come back home at the end of their training and provide to the high income countries, but then get the training and come back. This is something like a bilateral agreement that the countries themselves and our leaders have to sit down and talk about. But is it going to happen? It's happening at some level, but not as much as we would like to see it happening. And until we really address it head on, then it's going to be a problem. If you talk to the economist, someone like my husband believes that it's income for the country. He will start quoting you the numbers that the amount of repatriated funds that come into the country from the doctors in diaspora. And of course, I argue about the lives that we're losing. But we can do a lot more. India, for instance, is okay, we have a lot of people, right? So let's use those people as a resource. Let's train. India is training their indigenes to be exported as medical personnel. It is very difficult to get a slot to study medicine in the top medical institutes in India now because they only take indigenous students. And the reason for that is they want to start churning out doctors and exporting it the same way they export other goods to you. Okay, so you want doctors, here they are. We have them in thousands and millions. You can take them since we have the number of people. But that requires a very strong educational system from the get-go.
I love how you've explained the issues, and for a young professional who is clearly a little bit frustrated with the system in Nigeria and is thinking about, okay, what exactly do I do next? Where do I go? Do you have any words of encouragement for that person as to what can still be done in the Nigerian system as a healthcare worker?
I don't believe in holding back. I believe in coming back. It's good to go and learn. And if one is getting frustrated and needs a change, then there's hardly anything that we're going to say. I can lecture, I can preach, which I do. And like I told you, all they do is they just at me. You have done your own, you have gone. We have to go. So let them go and see how easy it is and learn, get the skills, be able to talk like me and appreciate both ends and appreciate the fact that you wake up in the morning or for a whole week, you're not going to talk to anybody aside from your patients. You're not going to see any black. There's some areas that you will work that you will not see another face that looks like yours. They're all white faces. So those things are the issues that will get to you and bring you back home. And when you think about your own people that are dying and you have these skills and you're not coming to help them. So I hope that that moral side will appeal to them. So like I said, I'm not one for saying don't go. Go, but please, by all means, always have it at the top of your mind or at the back or wherever that home is home and you're going to come back someday. That is the important aspect. And train other people, impart the knowledge that you have learned to save lives of your own people that matter.
I like that. I like how you put it because sometimes experience is like the best teacher, right? I mean, this was not part of the planned questions, but I just feel it within myself that I have to ask this. Like, how can
Absolutely.
we have, you know, a doctor of your caliber here and not extract some simple health tip for all of our listeners on the podcast. So do you have like any health tip that, living in a country like Nigeria, we have to always do something basic that we can all try and we can all get into?
Well, it's very easy to lecture, but I believe that 90% of those that will be listening to this podcast know the right thing to do, the right food, the right lifestyle, exercise. It doesn't have to be any vigorous exercise. Sometimes just walking around your workplace or going up and down the stairs twice instead of once can make a difference. And start early. Whatever you're going to do, start early, avoiding those things, drugs, cigarettes, what's the other one? Alcohol, all the vices that we know that are not good for us, then let's just try as much as possible to avoid them so that we can have a healthier future. It's not about now. If you look around and you see people with all sorts of illnesses, ask yourself, what kind of food was she eating when she was 20 or younger? How much sugar intake did she have? Why is she developing diabetes now at the age of 60, or he for that matter? So it's about having the right foundation and building upon it slowly. We can preach again, but I believe that most of our young people know the right thing to do. Peer influence is real, and we have to do our best to combat that. But with a strong willpower and keeping yourself busy, there is frustration, I agree. And sometimes opportunities do not come as quickly as we hope, or we do not have the right jobs that we're hoping for. But one thing that I always preach is have a broad outlook. Do not focus on one skill. I am a doctor, I'm a pediatrician, but I ended up in cancer advocacy. In the same way, I have other things that I do that will help me to have a regular life and more exposed life. Let me put it that way. What I'm trying to say is, as young people, we should always have an extra skill. Learn to do something. There's so much that we can do nowadays, whether it's weaving, makeup, hair, anything, sewing. Pick up a skill that will be able to, it might not be sustaining, you might not need it to sustain you, but it keeps you busy and keeps you away from those vices of life.
Thank you. Thank you so much. That was really, really beautiful. I really enjoyed talking to you. This has been a fantastic episode, and I have to say, I definitely enjoyed talking to you. I thank you so much for being here. We thank you for the opportunity to, tell us one or two about what's going on in the health sector and also sharing your experiences on the podcast. It was really amazing speaking to you. That was a very insightful conversation with Dr. Zainab. Please listen to other episodes. Please listen to other episodes of the podcast on any of your favorite podcast listening platforms, and watch the full video of this particular episode and other episodes on our YouTube on our channel, I Am Change Podcast. Also, join the conversation. Use the hashtag I Am Change Podcast across all social media platforms. Thank you for listening. Listen now to I Am Change Podcast on your favorite podcast listening platform.